When you come in for a consultation to decide if you're really a candidate for a breast lift, there are some things that we have to decide. I have a lot of people that end up, maybe after pregnancy, they've lost some breast volume, they've gotten a little smaller, and they're really not sure whether they're just empty or whether they really need a lift. Breast lift is really necessary when people have a problem with the nipple position being really low. So one thing that I look at is where the nipple is in relationship to the fold under the breast. If it's below the fold, then most people in that situation need a breast lift. Not everybody, but that's a common thing that we find. The other thing that I base this on is some measurements that I take. And so I'll take some measurements from the distance from the fold to the nipple, and that distance, if it's more than about 9 or 10 centimeters, then I would say that it's very common for us to need to do a breast lift. Now there are other variables that come into play. So when we go through your consultation, I want to be able to take a look at your anatomy, take a look at your goals about size, and then with those things together, it lets me be able to make a decision about whether a breast lift is right for you. The other thing that I think is important about breast lift to talk about is whether we need a breast implant or not. So I think a lot of people are confused with the idea that a breast implant is necessary for a breast lift, and that's not necessarily true. Breast implants are placed during a breast lift only if we need to add more volume. So if you feel content with your size, or maybe even content with being a little smaller than you are, then a breast lift can be done without the need for a breast implant. So that can help us just eliminate a few concerns or risks or future need for surgeries or things like that that may be associated with the idea of a breast implant being placed. So if you're concerned or interested or trying to sort out what your needs are, the best way is to come in for a consultation. That lets me be able to take a look at you and talk about your goals with you and take some measurements, and then we can be able to make a decision together on if a breast lift is right for you or not.